the jaw. All right, what does the jaw look like? Let's go over that first. This is our jaw joint, right? Right into here. This is where it is. So in here is where people would hear clicking sounds because in here, it sits a disc over top of that. And then when you are opening and closing your mouth, there's a disc that protects it here, right? And it moves like this. The disc can get caught up on either side of that and hear a clicking. If you get lockjaw, it means the disc has completely moved and it's stuck and your jaw can't do the hingy part that it's supposed to be doing. You can also get dislocations. Now, obviously, that's a medical concern that you need your doctor to check out with you and for you and get it fixed. But today we're going to talk about things we can do at home for our jaw. Now, it depends if you have a hypermobile jaw or not. And what does that mean? Hypermobility just means that you are able to open up your jaw further than its end range is supposed to be. Why is that problematic? Because your muscle tissue has to work really hard to try to keep everything in alignment. With hypermobility also comes a problem, not always, but sometimes, where the jaw comes more forward when we are opening, okay? So instead of just opening, right, like this, right, it comes forward like that. It's hard for me to do that because I don't have that problem. So then the muscle tissue is working incredibly hard to keep it in alignment when you are chewing, when you are talking, when you are yawning, when you are doing anything with your jaw that's opening and closing. So what does the muscle tissue look like around the jaw? It looks like this. You see this big muscle? That's called your temporalis. Temporalis is very important and you can self-massage it. It looks right into here, okay? Obviously, the masseters, those are these big chewing muscles, all right? And then there's there's muscles that are inside of the jaw that physios and massage therapists, maybe even chiropractors, I'm not exactly sure, are trained to be able to release and can help with TMJ pain, all right? Temporalis needs to be relaxed, okay? Because otherwise we get a zigzag pattern when we are opening and closing. Don't try to self-assess. I'm just giving you some things to look at maybe when you're opening and closing your mouth, okay? Now, temporalis sits right in here like a beautiful shell, right? And we want to massage that out. So you want to put enough pressure on there that it feels good. And I usually do little circles. Now, if you get to a point where it feels very stringy, okay, just gently go across it. So if the string's going this way, we want to just gently go across it. Okay, and you can do that on both sides. And don't forget to go all the way back, right? Because it's big. And so it would feel good to even release the edges of that particular muscle, okay, of the temporalis. You can massage your masseters, you know, by just going straight down. I find that it's a temporary fix. You really need to, you know what you're doing to get a good result from that. And I don't mean that in a mean way, but it's just a temporary fix because masseter is usually just a big muscle that's taking over, and it's the little ones that are usually, right, problematic, okay? So we can do some self-massage because it feels good. You can put a cold pack on the actual joint space itself, right? Freeze a little bath or like a hand towel, not a hand towel, you know, one of those face cloths. Freeze it, like wet it, freeze it, put it on your jaw, right? To help decrease inflammation, to help decrease the pain. If heat feels okay, put a warm cloth on it, you know, like you got to try things out, okay? So if you do not have hypermobility, definitely massaging it will probably give you the best results because it's not the joint that's actually, you know, usually the problem is just a muscle tissue that's really tight and the joint is healthy. Now, this is only if your joint is healthy because there's lots of things that can go wrong with the joint itself. Okay, we're not going to get into that because it's too complicated and the video will be like a half an hour. So what we can do though, even if you do not have hypermobility, but your jaw is coming forward when you are opening it, you will have a problem with the joint because we are not moving the joint in the way that it's supposed to, and it's a beautiful joint, so let's take care of it. One of the ways that we can fix it, and it's going to take time and it's going to take effort on your part, is by doing exercises. Exercises for the jaw. One of them is to learn how to open and close your mouth properly. All right, mostly opening it. But you're going to take your tongue, you're going to put it at the back of your front teeth. Okay? And then with that in place, you are going to open your mouth and close it. And close it. Okay? What that does is that it prevents it from opening up too far, and it also prevents it from going forward. So we are not doing this, right? Because the tongue helps to bring it up and down, okay? You can also use your fingers to kind of hold it back a little bit. I open and close it, okay? Whatever works for you. Do this every day. Do this multiple times a day when you are driving. Okay? Rest it when you need to, obviously. Don't go too hard if it's already inflamed and it's bothering you. But this is a great exercise, but you need to be consistent and you need to retrain your brain to learn how to open your mouth appropriately. All right, that's exercise number 1. Exercise number 2 is you need to strengthen the muscles around your jaw. And you might be like, well, what's the point? They're already super tight. I understand that, but we have lots of different little muscles inside that need to be trained appropriately. The key part to this is that you are not going to let your jaw move. If you are letting your jaw move, you are doing it too hard with too much pressure and too much intensity. Okay? We're going to go like this. And I'm going to push my hand into my jaw and I'm going to resist the movement. So my mouth is closed, no teeth clenching. Did it move? No. Okay, go the other way. It did not move, right? So that's right and left. We're going to push up. Hold of each movement for 6 seconds. Push down, so just use your teeth. Okay, and then the last 2 are pulling forward and pushing back. Okay, so pulling forward, you're going to do this again, holding your teeth, front bottom teeth. Okay, and then pushing back. So I'm pushing this way. Okay, so hold each movement for 6 seconds. Now, start off slow. Maybe repeat it once, see how your jaw feels. Tomorrow, you're going to repeat it 2 times, see how your jaw feels. The next day, and goes on until you work up to 6. You're going to repeat it 6 times, hold it for 6 seconds, because there's 6 movements. So you can't forget, 6, 6, 6, okay? But build up to it. Okay, so you're doing self-massage, you're getting everything loosened up, right? Working to your temporalis, get the masseter to relax a little bit so it doesn't overtake everything. It's also good to massage it this way. See how I do that? That looks funny. Okay, you can massage even under here. That can feel good. Be careful because there's nerves that sit here. Don't push too hard. Okay? Self-massage. Self-massage. Do your exercises. Push, 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 pull, pull, push. Okay? Do that. If you have TMJ problems, and you can really help yourself by doing this self-care. Let me know how it goes. Okay, bye.